I'm Mary Beth Poston. I'm an internal medicine physician with the Department of Medicine at Prisma Health. I am a lifelong South Carolinian. I grew up mostly in Charleston, South Carolina. Much of my family is there, but I've been educated at virtually all the major universities in the state. I got my undergraduate degrees at Clemson University. My medical degree and my residency training were done at the University of South Carolina in Columbia, and I spent some time down at the Medical University of South Carolina for my fellowship training in academic general medicine. Internal medicine doctors take care of all of the medical illnesses, both the acute medical illnesses and the chronic diseases that patients suffer from, and those could include things like diabetes, high blood pressure, high cholesterol, heart disease, many of the common diseases that we see in the southeastern United States. But we also take care of acute problems like infections, or even things like mental health illnesses, depression and anxiety. So it's really a broad spectrum of conditions for which we provide care. Internal medicine appealed to me because of a couple of things. One, I like sort of the puzzle solving aspect of determining what's going on with the patient and what might be the best way to help them to be better. But I also like the longitudinal relationships. I have patients that I've now provided care for more than 15 years. I know their children, their pets, their home and life situations, and just really find that very personally and professionally rewarding. I am a medical educator as well as a physician. So I use a lot of those skill sets both with my trainees but also with my patients. I feel like it's really important when teaching a learner or when teaching a patient to be a partner, to kind of understand their perspective, to sort of tailor their understanding of the disease to what they want and need to know and understand, and to really just kind of share perspectives with patients along the way to make sure that I'm individualizing how I educate them. I often do use examples from my personal life or my family life, just again to sort of facilitate that connection that I think is so important. Outside of medicine, I'm a little bit of a fitness fanatic. I really enjoy exercising, and that is sort of my standard stress relief. I don't necessarily have a lot of other interesting hobbies. I do have what I fondly refer to as my two big mutts in my home, and I do enjoy spending some downtime with them. But one of my favorite things to do is to connect with my adult daughter, who is now an obstetrics and gynecology resident. So it's been really fascinating for me to watch the trajectory of her medical education, her experience. We don't have a lot of free time together, but when we can align our free time, we just love to get together and kind of share stories and just spend some time together. To make an appointment at our practice, please call the number on the screen.